How to inject Pregnyl intramuscular injection, presented by Fuze Health. Getting set up. The box of Pregnyl comes with a vial of powder containing 10,000 units of Pregnyl and a 10 milliliter vial of diluent for mixing. For this injection, you will need 1 vial of 10,000 units of Pregnyl powder, 1 vial of 10 milliliter diluent, a 3 milliliter syringe, a 1.5-inch mixing needle, an injection needle, a few alcohol pads, a sharps container, and sterile gauze or tissue is optional. Examine your medication. Make sure the medication is not expired. Check to ensure there are no cracks on the vials and there's powder in the powdered vial. Also make sure the diluent is clear and does not contain any particles. If you see anything, call your provider or a Fuze pharmacist for next steps. Prepare the medication. To begin, flip off the caps on the vial of Pregnyl powder and a vial of diluent and wipe the tops with an alcohol pad. Unwrap your syringe and mixing needle and attach the needle to the syringe. If your syringe and needle already come attached, you can skip this step. Pull back the plunger to draw air into the syringe. Fill the syringe with the same amount of air as the amount of diluent you are instructed to mix with. This is usually 1 milliliter or 1 cc. Place the vial of diluent on a hard, flat surface and insert the needle straight through the center of the rubber stopper. Slowly press on the plunger to push the air in the syringe into the vial. This step will make it easier to withdraw the solution because the vials are pressurized. Invert the vial and pull back the plunger to withdraw the amount of diluent you are instructed to mix with. You will not need all of the solution in the vial. When you're done, flip the vial back and remove the syringe from the vial. You can discard the used valve diluent into the sharps container. Place the vial of Pregnyl powder on a hard, flat surface and insert the needle straight through the center of the rubber stopper. Slowly inject the solution into the vial of Pregnyl powder. Without removing the needle, gently swirl the vial until all of the powder is dissolved. Do not shake. Pregnyl powder usually dissolves fairly easily. Without removing the needle, invert the vial and slowly pull back the plunger to withdraw the entire contents of the vial into the syringe. The amount of liquid inside the vial is fairly little, so you have to slowly pull the needle out of the vial as you withdraw the solution to ensure the tip of the needle is submerged in the solution. This will make sure you are drawing up the liquid and not the air inside the vial. Once you've withdrawn all of the liquid, remove the syringe from the vial. Recap the needle. Twist it off and discard it into the sharps container. The safest way to recap your needle is to lay the cap on your table and scoop up the cap with your needle, like so. This will reduce the chances of a needle stick. Now attach the injection needle to the syringe and pull off the cap. To remove any air bubbles, tap on the side of the syringe so the bubbles move to the top. Gently push on the plunger until you see a tiny droplet come out of the tip of the needle. Once you see the droplet, you are ready for your intramuscular injection. Because an intramuscular injection can be uncomfortable, you can ice the area for a few minutes with an ice pack prior to injection to numb the area. You should also alternate your injection sites to decrease discomfort. To prepare for your injection, clean the injection site with an alcohol pad and allow the area to air dry. Hold the syringe in your dominant hand with your thumb and fingers like you would hold a dart. Firmly stretch the skin at your injection site with your thumb and index finger on your non-dominant hand. Insert the entire length of the needle into the stretched skin at a 90-degree angle with one swift motion. Stabilize the syringe with your free hand and pull back slightly on the plunger. If you see blood return, do not inject the medication and withdraw the needle. Repeat your medication preparation process and inject at an alternate site. If there's no blood, the needle is inserted properly, and you can inject the medication slowly. Push on the plunger in a slow, steady motion until all of the medication is injected. Quickly withdraw the needle when you are done. Lastly, apply pressure to the injection site with a gauze or tissue. Discard the used needle and syringe in the sharps container. Gently massaging the injection site afterwards can help to reduce discomfort and spread the medication. You can also apply a bandage if needed. There may be minor bleeding, bruising, and redness around the injection site. All of this is common and should not be of any concern. Let's talk storage. Before mixing, Pregnyl can be stored at room temperature until the expiration date. Once the powder has been mixed, it must be stored in the refrigerator and expires within 60 days of mixing. Great job! You've completed your injection. If you have any questions or need support, contact your healthcare provider or reach out to Fuze Health.